Are you feeling overwhelmed about sitting the MRCGP SCA? You might feel that this is a daunting exam due to the uncertainty, the wide curriculum that you need to cover, and having to perform under exam condition. In this video, I'm going to share with you what is a SCA, what are the essentials you need to know, and how to prepare for this exam. If you're getting started with the preparation, then this is a video you want to watch until the end. My name is Dr. Erwin Kwun. I'm a portfolio GP and I'm a director of ECC Kwun. So I'm on a mission to help doctors lead a fulfilling life. As you can tell from my accent, I'm not a native English speaker. I came from Mauritius and I pursued my career here in the UK. Some of you might be able to relate. If English is not your first language, there's a language barrier. But I had to work on my communication. And growing up, I was shy. I was named the shyest student of the year in sixth form. So I had to step outside of my comfort zone and build my confidence. The reason I'm sharing this with you is because some of you might feel a little bit not very confident to sit this exam, and confidence is really important, and being able to communicate clearly is really important for this. After passing my MRCGP exam in December, I CCT'd in 2021, and I have been coaching GP trainees with their final MRCGP exam. I've coached over 100 GP trainees now. And the reason I do this coaching is because I have benefited from coaching myself, and I hold a PG cert in applied positive psychology and coaching psychology. This is something that has really helped me, and coaching is really helping people in terms of helping them find clarity and have a breakthrough when they're stuck and not sure how to progress. The simulated consultation assessment is a new exam that's replacing the RCA. So this is one of the components that you are required to achieve your MRCGP. It is an exam that's sat during your SC3 year or later. It is conducted in a local GP surgery. The exam fee is 1180. So it is quite a large amount. It's important that you try and get to pass it first time, because passing it second time or third time is going to cost you quite a lot. Although you're able to sit it up to 4 times, ideally you want to sit it once and be done with it. The format of this exam is that you will have 12 simulated consultations, and these consultations are going to last 12 minutes. You will have 3 minutes reading time, and unlike the RCA or the CSA, this exam is not an open book exam. So the thing is, when you're preparing and revising, you might be using nice CKS and BNF, but for the exam, you won't be able to access all this information. So it makes the exam more challenging. So when it gets nearer to the exam sitting, it's important that you practice under exam condition to see how you navigate without the resources that are available to you, and see how you're getting on. It's good to use the resources while you're learning and preparing, but you also need to practice under exam condition, because otherwise when it comes for the exam, you might not feel that confident to do it. With the exam, it's going to be standardized. So that's a good thing about this SCA. It's a hybrid model between the old CSA and the RCA. So in the fact that it's done remotely, and it's using simulators. So these are simulators that has been trained and calibrated for these role plays. So all of these simulators, they have been given a script. So depending how you're asking some of the questions, you might get various answers, but all these answers have been calibrated. So there are questions that might not be helpful if you're asking. For example, if you're asking a simulator, what symptoms did you have? They're not able to disclose you certain information if you're not asking specific questions. So they might say to you, what do you mean, which symptoms? So you need to be more specific. Whereas for the real life type of cases, if you ask a patient, what symptoms did you have? They will be telling you. So with the SCA, because it's an artificial consultation, the simulators have been given instruction what they can tell you and what they can disclose only if you're probing and asking. So it's going to be a mix of video consults and telephone consults. So you will have approximately 9 video consults and 3 telephone consults. All the cases are going to be recorded and then marked at a later date. One thing to note is that physical examination is not assessed for the SCA. So even sometimes in the cases, you might feel like you want to examine a patient. You can still ask for if you want to make an appointment for the patient, but you won't get any mark and not going to be assessed on the physical examination. That's different from the RCA where currently you're supposed to offer examination or undertake an examination. Whereas for this exam, that's not part of what is being assessed. The exam dates have already been published by the college. So it's going to run from November until June, except in December, there won't be any sitting. So if you're thinking about sitting it, make sure that you make a note of the booking period so that you can book your seat for the exam, and let your rota coordinator and supervisor already know when you're planning to sit this exam. Planning is really important for this exam. Think of it like you're running a marathon. If you're running a marathon, you're not just going to run a marathon. You need to plan it and prepare. It's not something that you can just do on a whim. So make sure that you plan early and prepare. I'll give you some more tips how to prepare for this exam in a moment. On the day of the exam, then you might be given either a morning session or an afternoon session. So if you're given a morning session, you will start at 9 o'clock. So that will start with login, and the invigilator will verify your ID, and they will also proceed by verifying the environment you are. So you won't be allowed to sit this exam in the comfort of your own home. You have to be in a GP surgery to sit this exam. And the invigilator is going to ask you about sharing your webcam view to see the room around, to see whether there's any notes around, because they want to make sure that there's no notes and people are not cheating, so that the exam can be conducted fairly. Once these checks are done, then you'll start by the first case at 9:30, and you will go through 6 consecutive cases, and then at 11 o'clock, you will have a comfort break. This is going to last 10 minutes. And then after that, you will have 6 more cases, and you will finish at 12:40. Now, some candidates might require some reasonable adjustments. So the consulting time might be longer, or the reading time might be longer. So these candidates might finish later. For some reason, if there is any issues while you were running the exam, for example, let's say there was a problem in the connection or an interruption while you were doing station 3 or 4, then you will be able to rerun these stations. So you'll have to stay longer. Then at 1:20 p.m., the exam ends for everybody. If you're given an afternoon sitting, it's similar process, but you start at 1:40 p.m. and you finish at 6 p.m. So it's very important that when you're sitting the exam in your practice or a local GP surgery, that there's no interruption, that nobody comes and knock on your door, or your phone is ringing, for example, because that's going to interrupt you. Now, looking at this diagram, it's going to give you an idea how the exam is going to run. When you go through the exam, it's very important that you stay focused. Imagine you are the pilot of an aircraft and you're trying to learn an aircraft. Imagine the focus that you need to have if you were doing that for each of the station. The reason I'm saying you need to stay focused and be physically present for each of them is because let's say a candidate has messed up case number 2. If now they're on case number 3, they worry that they missed a question, they think that they screwed something, then they're going to carry that for the next few cases. And because they're so stressed and worried about the previous mistake they've made, it's going to affect the performance in the following cases. And that's going to be a disaster, because that's going to affect the whole performance for the assessment. Whereas if you focus on the case you've got and isolate and keep the previous case behind, and don't really think about it because you're not able to do anything about the previous case, then you're going to score better in the next case because you're not going to be so stressed about what you miss. And by using that approach, you might compensate for that mistake you made by scoring higher in the following cases that you're going to sit then the overall mark is going to be higher. Once you've got your 6 cases done, during your comfort break, try and relax and decompress. If you need to stretch your arm or legs, take a deep breath in and out. That can be helpful as well, just to diffuse some of the tension before you tackle the next 6 cases. So make sure that you practice a couple of mocks as well before you sit your exam, because doing these cases back to back can be stressful. You will have 3-minute reading time for each of the cases. How you use that is critical how you're going to perform. So let's have a look at this case. This is a case where there's a district nurse who sent a message to the GP about Mr. Nick Jones. She's worried that this patient's got diarrhea for the last few days and has been having some issues where the blood pressure was a bit more on the low side. We've got the blood sugar level. She's also done a keto urinary dip that shows no ketones. So when you're reading this, it's important that you think about how you're going to approach this consultation. Read the case briefing carefully. Make a note of what is important. If you need to make a mental note of the keywords and play out the consultation in your mind. Anticipate what issues you might encounter in the consultation, and also consider how you're going to solve that issue, what management plan that you need to consider. So by doing that thought process, playing it out in your mind, you're going to be in a better position starting the consultation. So in this case, I'd like you to think about what are the concerns you've got from this, reading this and looking at the keywords and the symptoms that the patient presents. Write down in the chat box what are the things that you think might be concerning here. What are the things that you might need to do? Definitely a concern if the patient is dehydrated, then they might be at risk of AKI. So thinking about admission, safeguarding is a very good one, yeah, because the patient is also a carer. So who's going to look after the wife? You need to consider not just a medical aspect, but also the social aspect as well. And in this case, you might consider whether this patient is suffering with gastroenteritis, diverticulitis, whether there is any red flags at all, weight loss, or blood in the stool, and consider any complications. For example, like the patient might have AKI if they're dehydrated. Would you consider discontinuing Ramipril? So all of these things, when you're thinking about it before even starting the consultation, will give you a head start so that you're not unsure what to do in the consultation. The 12 minutes can go very quickly in the exam. So when you have done that prep work and you've primed your cases, then your thoughts are going to be more organized and you're going to have more structure in your consultation. That really helps when you're making your plan, because a major problem is people don't know how to prime their cases. And that's a game changer, because even before you start the consultation, if you have not primed it very well, you're not off to a good start. So then once you prime it, then you know what you're going to discuss and how you're going to manage the case. And that will help you in terms of the confidence as well, because sometimes if you're not sure about your case, you might not be that confident to transition to clinical management. So you're stuck in data gathering and might be asking the same question and not utilizing the information that's already been given to you. So let's talk about the purpose of the SCA. It's important to come to why you're doing this exam. The reason you're doing this exam is because we want to make sure that you're able to show that you can demonstrate practice as an independent UK GP. So you can practice safely. So these are the 4 core requirements that examiners are looking for. Whether you're able to keep patients safe, whether you can adapt, how adaptable you are in treating different types of patients and illnesses, how are you managing this risk, medical complexity and uncertainty. The exam reflects modern general practice where there is a lot of risk that GPs manage, medical complexity and uncertainty. So you need to demonstrate that you're able to manage these risks, complexity, and uncertainty. And lastly, you need to demonstrate that you can exhibit appropriate behaviors, attitudes, and concern for your patients. So the key words here are behaviors, attitudes, and concern. The examiners will mark you based on what they can observe. So they can observe your behavior, they can observe what you're saying, what you're doing. And if you're not saying something, then they can't read your mind. So it's important that you need to exhibit that, because sometimes people might not know how they're going to be assessed. It's a bit like when you're doing a driving test, there are things that you need to be doing when you're driving for a test, whereas when you're driving after you've got your license. So it's an exam, so you need to show your best practice. The college has published a blueprint of cases that are going to be featured for the exam. So there's 12 clinical experience groups. For these clinical experience group, you need to make sure that you cover all of them and you identify which of the clinical experience group that you might not have a good experience and you need to work on. Each of them are going to test a set of capabilities from the candidate. So the first one is patient less than 19 years old. This could be potentially a mom who's presenting because the 4-year-old has been wetting the bed, or it could be a mom who's worried about his child having abdominal pain, or it could be allergic reaction. For gender, reproductive, and sexual health, you might get a case of menopause where a woman is going through menopause and is looking for advice and help. It could be a woman presenting with heavy menstrual bleeding, or it could be a woman who's had results of a scan and want to discuss it. One of the case example in the RCGP website for the SCA, you could see there was a woman who had all the investigations, but was still concerned despite the result being normal. And that was one of the cases where they were assessing how the candidate deal with that. Further cases you might get are long-term condition. You could get a patient who is disabled, or you could get a patient who's got multiple comorbidities. For example, you can get a patient who's got some various problems like COPD, diabetes, and having problem with the blood pressure. So there's multiple comorbidity, and all these are chronic problems that they've been having. How are you going to manage all these problems together? Then you have mental health cases. So mental health cases could be insomnia. You can get a patient who is presenting with really bad insomnia and requesting sleeping tablets. How are you going to manage that if you're getting a patient who's demanding? Or you can get a patient who is presenting with anxiety or depression. There might be some safeguarding issues if the patient has got a child and is drinking alcohol, using recreational drugs. So safeguarding is one of the things that is also mentioned in the domain in the relating to others. So expect to have cases like that. So for the urgent and unscheduled care is how you're going to manage an acute case. So this could be a patient presenting with chest pain, breathlessness, or palpitations. How you're going to manage that remotely. Health disadvantage and vulnerabilities could include a patient who is homeless, might have some issues such as social problems, and this is impacting upon their health. So you could get a patient who's got various issues, and they might be IVDU as well, and how you're going to manage that. For older adults, this could be a number of things that you could get. Potentially, you could get a case where patients having frequent falls, they live on their own, and there might be risk. You could have polypharmacy. You could have a case where a patient is presenting with memory loss, and it's a daughter who is concerned and want to have a chat with a GP. So how are you going to make an assessment and manage that as well? Ethnicity, culture, diversity, inclusivity is something that you might get where you're actually getting a patient who's an asylum seeker or a refugee who might not be aware about the healthcare system in this country, and they don't know how to use a healthcare system, for example, and you might need to have a discussion with them. Or you could get a a patient who's actually got diabetes and is planning to fast for Ramadan, and this could affect their sugar control, so you might need to advise them. So there's various cases that you could be tested on. So you need to be prepared for all these scenarios. New presentation might get something like tiredness all the time, so vague symptoms, how you're going to make a safe assessment, show that you're exploring a wide range of differential and being able to commit to working diagnosis and manage this problem. For prescribing, you could get a case where you need to start a patient on a certain medication. It could be, for example, you receive a letter from a specialist and you need to discuss a medication for a treatment, or it could be starting a DOAC for a patient who's got a new onset of AF. For investigation results, you might get an investigation that you need to discuss. It could be a breaking bad news station. So how are you going to do that remotely? You need to be more sensitive, especially if you're doing it remotely. And what are the things that you might need to think about? For example, using SPECS protocol to deliver that bad news sensitively. The last one, professional conversation and professional dilemma. You might not get that much experience with this. So this could be discussion with a district nurse, or it could be discussion with a police officer who's requesting some confidential information about a patient, or it could be a patient who's complaining about another colleague, or you might feel like a colleague has got some issues and you think that can affect their fitness to practice. So how are you going to have that discussion with your colleague? So as you can see from the collection of cases, it's going to be quite complex and challenging. And that's the purpose of an exam. They want to test various skill sets that you've got, which is why it's important that you identify which area of the blueprint that you might have a weakness and work on that. So how is a SCA marked? The SCA is going to be marked based on 3 domains. There has been changes to the domains. So data gathering and diagnosis is going to be related to what you probably know from the previous exam, data gathering, but now there is a diagnosis as part of it. Clinical management, there has been more complexity added to it now. It's medical complexity plus clinical management. And relating to others, which is what used to be interpersonal skill, has got a new dimension now. So there's also safeguarding issue as part of relating to others. The examiners are going to give you a grade for each of the 3 domains. So the clear pass is when you demonstrate that you're above the standard of a newly qualified independent GP. So this is when you have impressed the examiner that you've done a really fantastic consultation. Pass is when you demonstrate sufficiently that your standard of practice is as expected to a newly qualified GP. Fail is if you have insufficiently demonstrated the standard of a newly qualified GP. And clear fail is when it's clearly below the standard of a newly qualified GP. So for data gathering, to get a pass, you need to demonstrate that you're able to utilize the information that has been given to you and elicit a history by target the information that you need by taking a focused history based on what needs to be elicited for the patient and their problem. And also you need to be doing that in a systematic approach so that you're logical in your process of coming to working diagnosis. So if a candidate comes to working diagnosis, which is the same as another candidate, it doesn't mean that the candidate who's got that will still pass. The way that they come to that working diagnosis might not be safe. For example, they have not considered wide range of differentials. So although they might get that diagnosis right for that case, the examiners might be concerned that in the future, that candidate might miss something that's rare, but is very important. So you need to show that your workup is logical and you're thinking about various differentials to come to working diagnosis. There will be times when it is a bit uncertain and undifferentiated, in which case you need to rely on first principles so that you're managing it safely. Sometimes if you're not sure about something, then it's okay to be not sure, but what are you going to be doing to find out and assess this problem safely? So you need to show that as well. How you're going to use first principle. For example, if you use time as a tool, or if you're going to seek help, or how you're going to find out how you're going to manage this uncertainty. For clinical management and medical complexity, you need to demonstrate that you're able to formulate a safe and appropriate management option. And this is including effective prioritization. So there might be multiple problems in a case. So how you're going to prioritize based on urgency and importance, and also how you're going to use continuity of care, time as well, and empower the patient to manage the problem, especially when it comes to chronic conditions, how you help the patient to manage the problem. You also need to demonstrate commitment to providing optimum care. So optimum care means that you can provide the best care possible given the situation that you're in. So we're aware that there is limited resources, but have you demonstrated that you've done the best that you can in that situation? So not just fixing the short-term problem, but long-term as well. This comes in where there is health promotion advice, how you're going to do that. And there might be some challenges as well. So for relating to others, there's this dimension of ethical awareness in this. So you need to demonstrate that you are consulting the patient with autonomy, that you're able to communicate with a person in a person-centered way, not a doctor-centered way. And doing that remotely can be challenging because of the barrier of not seeing the patient face-to-face, where you have an interaction in person. So how you empathize remotely, how you show that you're actively listening to that patient. So you need to demonstrate that you're also flexible in your approach, and that you can come to a negotiation, especially if there is some difficulties because of the patient's preference or circumstances. How do you get to that shared understanding and reach a shared management with your patient? Besides the marking on the domain, you will also be marked by the examiner, where they will give you a global mark for each of the cases. So the examiner will think globally whether you have passed that station or not. So pass is where you clearly meet the criteria, you've got the right amount of knowledge, and you're meeting the standard as a newly qualified GP. Bare pass is you might have made some mistakes or omission in the case, but generally they are satisfied with your performance, so they think that you're fit to practice. Bare fail is that it might be incomplete evidence that you have shown, or it's not substantial, so they are not completely happy that you can practice as a safe, independent GP. Fail is when it's potentially dangerous to the patient, or you provided very minimum evidence that you can practice as a safe and independent GP. So the global rating is going to be used for calculation of the mark as well. It's something that is used for OSCE examination, how they calculate the pass mark for each of the station. So it's a borderline regression, and what it means is that if a case is easy, there'll be more candidates who are going to score higher. So the pass mark for that case is likely going to be higher. But if a case is very challenging, the likelihood of many candidates to score high is lower. So the pass mark might vary then. So the pass mark is going to be determined based on the performance across the whole assessment. So they will use all the global mark and the domain mark, and then calculate what is the pass mark for the whole examination. So as a candidate, you won't have to pass a certain number of stations in order to pass. It will be the overall mark that you have got, and whether that's above or equal to the pass mark. Unlike the RCA, the exam for the marking is weighed differently. So, in the RCA, all the three domains were equally weighed, whereas in the SCA, the domains are not equally weighed, and clinical management and complexity domain is likely going to carry more weight than the other two domains. So this is a domain that most candidates struggle with. If you don't score very well in clinical management, then it's going to pull your marks down. So it's important that you focus on how you can score well in clinical management. Looking at the feedback statement is very important. This information, I would recommend that you use it to study it, not just read it, but study the in and out of this feedback statement, each of the statement, so that you can use that to avoid any common pitfalls. These are things that examiners commonly see, and they use that feedback statement to tell candidates what are the things that they have not done well. So in data gathering and diagnosis, it's important that you make sure that you're logical in your approach. If you look at statement number 8, decision making or diagnosis was illogical, incorrect, or incomplete. So as I said in the past, the logic as in how you came to that working diagnosis is very important. Also, whether you're thinking about the various range of differentials, how you're coming with that hypothesis. Other things to consider is whether you are exploring relevant psychological or social information and recognizing it. So commonly, many GP trainees, they focus so much on the medical history that they neglect the psychosocial aspect of the case. And in some of the cases, the heart of the problem could be due to psychosocial. And if you're not asking the relevant psychological information, then you're going to miss a major piece of the puzzle to solve that problem. So you need to be holistic in your approach. When we look at the clinical management and medical complexity domain, a new addition is a time management in the consultation. So if you look at statement number 8, time management in the consultation was ineffective. So when you're not using your time effectively, what tends to happen is that you spend too much time in data gathering over 8-9 minutes and then squeeze clinical management. This is where it affects your mark in clinical management because you won't have enough time to discuss management, and you might be rushing it and it's inadequate. So that's something that's very commonly reported in the clinical management part of the consultation. So make sure that you really keep track of your time and make sure that you're able to consult within 12 minutes. So for relating to others, there is various changes in the feedback statement. One of the things that I want to draw to your attention here is the teamwork or understanding of others' role was insufficiently recognized or responded to. So for example, you might get a case where there might be somebody else who is a better person to actually help in that situation. So if you don't know the teamwork, the roles of other allied healthcare professional, you might not recognize who is the best person for this issue. And there's also a safeguarding concern as well. How do you respond or do you recognize safeguarding concern? So this is really important to make sure that you practice some of the safeguarding cases. Not all of these will be relevant for each case. Some of these might not be relevant, but there might be cases where safeguarding is what they want to test from a candidate. So I want to share this quote from Benjamin Franklin with you. By failing to prepare, you're preparing to fail. So this is really important to understand. And for you, I don't think this is an issue because most of you are here because you're thinking about how you can prepare. So by doing that, you're already preparing to succeed. But if people don't prepare, they're preparing to fail. What are the things that candidates who fail tend to do? They tend to sit the exam too early. If you're starting your ST3 in this August, and you sit the exam too early, you might not have enough time to prepare for this exam. So you might be in the exam with other GP trainees who've already been doing GP training ST3 for 6 months. They will be at a different level to you who just started your ST3 year. Inadequate preparation is rarely an issue. So some people might not know how to prepare and they don't put in the time and effort that's required, or they are not getting the right guidance. So then the preparation is not sufficient for them to get to that level to pass exam. Poor time management is definitely a major issue among a lot of GP trainees. Doctor-centered care, some of the doctors might be paternalistic, lecturing patient what to do. Confidence is an issue as well. Some trainees have a lack of confidence, so they don't feel that they're confident, and when they are consulting the patient, there is no conviction in what they're saying, and it's not really something that would help them to score well because they lack that confidence. And if it's an exam, then you need to perform as well. Overconfidence is on the other spectrum where somebody might be too confident about the skill, so they don't know what they're doing wrong. They think that's right, and that's very dangerous. So another issue is that candidates, they don't seek constructive feedback during their preparation. So if you're not getting constructive feedback, it's very difficult for you to improve and know what you need to work on. So that's important to seek constructive feedback. Sometimes candidates might appear insensitive or they fail to empathize. For example, if a patient is saying, I've got a really bad abdominal pain, and the candidate says, fine, all right, and then ask more questions. See how it sounds a little bit insensitive if you're saying all right. Poor listening skills and not responding to cues is another issue that affects relating to others. So sometimes people are not really actively listening. Maybe they're preoccupied in the mind or they're thinking what to ask next. So what do high scoring candidates do? They plan and prepare early. They have a self-awareness. They adopt a growth mindset. So they are really interested to know how they can improve, and they're learning and they understand the exam, what examiners are assessing. They also target the revision, looking at what are the areas of weakness and going for a proactive revision to work on these areas. High scoring candidates, they actively seek feedback and they reflect on their learning. They're comfortable to consult effectively within 12 minutes. So, for example, if somebody is currently consulting at a 20-minute appointment slot, it might mean that that person is not ready yet. They might need to reduce their time to consult within 15 minutes, then 12 minutes, so that they get to that level where they can pace a consultation within 12 minutes. So it's important that you know when is a good time for you to sit the exam. And it's going to be different for everybody. Some people, they might need 3 months, other people might need 6 months. So high scoring candidates, they embed good consultation practice and they develop their own style. So the consultation comes naturally to them. One thing that I've noted after coaching over 100 GP trainees, what it comes down to for those who are high performers in the consultation are that they're in complete alignment. Their attitude, the skill, and the behavior are in complete alignment. So they are congruent. You know how sometimes the GP trainee might say something, they say, I'm sorry to hear that. It doesn't sound congruent at all, and patient can pick up on that. And if your behavior sounds incongruent to what you're saying, you don't say what you mean, then it's going to backfire. You might not score very well for that. So to do that well, you need to be congruent. And so many times people focus so much on the skill, but they also need to address the attitude as well. If they don't address the attitude, no matter how skillful you are, then your behavior that you're going to demonstrate is not going to be congruent and you're not going to consult in coherence. So that's why it's important to have a caring attitude, to communicate with care and work on your skills well. And then you can demonstrate that coherence when you're actually showing what you're doing. So the examiner is going to observe your behavior and they are picking up on all this. The quote I'd like to share with you is by Archilochus. We don't rise to the level of our expectations. We fall to the level of our training. Essentially, what it says is that, for an exam, don't expect that you're going to rise to the level of expectation to pass it. It comes down to what you have done before the exam, before sitting it, like the preparation, how much training have you gone through, the level and intensity of preparation. The work is done before the exam. So if you have been training to a very high level, then when it comes to exam, you will fall to that level. So how do we prepare then? It's important that you use strategy in your preparation. If you don't use strategy, you're going to work hard, but you might not work smart and you might not get the results you want. By applying this strategy, these are strategies that help many GP trainees for the exam. So first of all, you need to decide which sitting you will take. So the exam have already been set, which date is available. So decide which date that will be best for you. Give yourself ample time so that you can embed consultation skills. It's important that you plan at least 6 months before the exam. You have some sort of planning as in how you're going to approach this exam. Then you need to identify your blind spots, the areas of weakness you need to address. For example, many male GP trainees, they have a struggle with gynae problems, sexual health. So it might be a good idea to arrange a half-day release to attend a gynae clinic. So if you go and attend an outpatient gynae clinic, you might get some more knowledge how to elicit a history, how to think about taking a gynae history and as focus. So then what you need to do is seek regular feedback and adjust your consultation. In terms of the tactical level is that you need to record your consultation targeting the SCA blueprint selection. So you can record consultation that you're doing in your practice with permission from your patient, and then analyze this consultation, see what you're doing right, what you need to improve, and get feedback from your colleague as well. You can join a study group with other trainees, ideally trainees who are sitting the exam on the same day as you. So for example, who are sitting it in November, because then you have a timeline that is going to work for all of you in the group. If you're going to sit an exam with a trainee who is preparing for January, their pace is going to be different from you. So ideally you want similar sitting. Learn to manage risk and uncertainty. So this is where it's helpful to organize a joint clinic with your trainer and get the trainer to see some patients, and so that you can observe them and see how they're managing this risk and uncertainty. And then developing your skill at managing complex problem. So this is where you can see how more experienced GPs are doing it, and then look at how you're doing it as well and what you need to improve in the skill set to manage this complex problem. It's very important that you think about it as you're training for a marathon. This is not a sprint. So this is something where you need to keep refining your consultation skill. And this cycle, when you consult, you self-assess, seek feedback, adjust, implement, and reconsult, is what will help you to continuously refine your consultation and get better. If you only get better by 1% every day, by the time you sit the exam, you will have improved by a lot. So let's go through a case. Let's say you get this case for your SCA. This is telephone consultation, and the patient has sent their photograph of their skin. So based on this information that we've got, what other thing that's going through your mind? What do you think might be happening here? When you're priming this case, you need to consider what is the nature and distribution of this skin problem. It looks like it's very flaky skin rash, and it's affecting the extensor surface of the elbow joints. So potentially it could be psoriasis. We need to know what's the history, whether this is new or has this been ongoing, and how long has this been going on. Whether there are any potential triggers to this symptom. Why is this patient presenting now? There is also, in the past medical history, you can see that the patient's got anxiety disorder. So when you're having a patient presenting with skin problem, be mindful about how is this affecting their body image, because some patients can have anxiety because of their skin problem. So this is something you might want to ask as well. How is this affecting their mental health? Other things to consider is risk factors. You know, with psoriasis, there's cardiovascular disease risk factor. So this is something you need to explore as well. Looking at the case note, you can see that the patient drinks alcohol and is an ex-smoker. So there's already things like suggestive of risk factors for cardiovascular disease here. So we might need to consider that. And also explore the psychosocial For example, the occupation here, is anything with the work, is this affected his work being a waiter? If somebody is serving food, then it might be something that they're more conscious about. If they've got skin, flaky patches, whether any customers have made any comments at all. So then you also need to be thinking about the treatment. So what sort of treatment would you consider here? We need to know what the patient's tried first and what hasn't worked, and then what we could suggest. When you're consulting a case of a patient who is presenting remotely, they've shared their skin photograph, then with a telephone consultation, it's something that you need to learn how to build that rapport. It's important to use your tone of voice to open up the consultation first and explain the patient you've had a look at their skin on the photograph. Thank you for sending it, because that will help the patient to know that you've taken time and you've already checked their photograph. And then you can say, I'd like to ask you a few questions to help me understand the skin problem. And then you ask more questions. You get the patient's health agenda. So you elicit what's the idea, the concern, expectation. And you do that in context. So it should not be formulaic. And then once you've got the expectation, when you come to the management, then you can readdress expectation and discuss what treatment you think would be suitable for them. So explaining what moisturizer that could be used in the long term for the treatment for the skin. Also in the short term, what you think might be suitable. For example, 1 month course of topical potent steroid and a vitamin D analog that they could use. You could either prescribe it separately or in combination. And what are the lifestyle changes? So for example, if there's any triggers that the patient might have, then consider what are the triggers that need to be avoided, and any health promotion advice that you might need to provide, and whether you consider any follow-up arrangement to see the patient. And that's where you have a whole package in your management. I hope you found this useful, because it's very important that you think about all of these when you're priming your case. You see, without discussing the patient, there's a lot that we can do in preparation for the consultation. So next, I'd like to share with you a story. This is Dr. Inamuna, a GP trainee who failed the MRCGP exam 4 times. His confidence was at rock bottom. He hit a brick wall in his training. And this is really something where I want you to be able to learn from not just your mistake, but from other people's mistakes so that you don't repeat it. And the problem with Dr. Inamuna was that he struggled so much with the time management. He found it difficult to compress his consultation within 12 minutes. And having done it 4 times, he didn't know what else to do. He found it really a struggle to know what to do next. Although he's worked hard and he's been preparing, the problem was he was not working on the right stuff. And he's picked up some old habits that was an issue in his consultation. So when somebody's already got their habits with the consultation, first, they need to unlearn these old habits before they can learn the new habits that they can consult. We had a chat, and after identifying what was the issue with his consultation, we managed to compress his consultation, and he was able to consult within 12 minutes. And eventually, Dr. Inamuna passed his final MRCGP exam with a score of 164 in his 5th attempt. And he's now working as a locum GP. And this was his last attempt. Exceptionally, they gave him a 5th attempt, which is not usual. This is really something you want to avoid. You don't want to go through this exam going through it 4 or 5 times. You want to pass it first time round so that you're done with it. So that's why it's important that you follow a clear pathway so that you do it in a way that you're not making the same mistake as other people. This is why I developed Consultation Blueprint, which is a program that takes you every step of the way for your preparation. We lay strong foundation so that you can embed good consultation skills such that when it comes to the exam, even though you're stressed and you're having to sit an exam, you will fall to the level of your training. So if you've been trained well, you have gone through these complex and challenging cases, you will fall to that level. And it will come naturally to you because you have embedded good consultation practice. So we focus on consolidating your consultation skills. We focus on three core pillars. The consultation skill, we focus on your mindset and we focus on the strategy, how to use strategy to plan your revision so that when you're consulting, you know exactly what are the things that you need to work on. And when it comes closer to the exam, you can fine tune and refine your consultation so that when you sit the exam, you are at the most highest level where you're ready to sit it and eventually are able to pass this exam. So if you're happy, I'll share with you some resources that we have developed in collaboration with examiners, simulators, and trainees like you to develop a program to help you with your preparation. There's also a case series of SCA consults that is mapped on the blueprint. So you will be able to see high performing consultations where I show you various cases, challenging cases, genetic cases, and you will see a variety of cases. So this is where, when you're learning from observation, you will know what are the things that will help you to score higher mark. I show you exactly how to develop your own consultation style that comes naturally to you based on various common consultation models. For example, Neighbors, Calgary, Cambridge, so that you can work on a consultation that will suit you because everybody consults differently. So there's no right or wrong there, but I'll show you how you can consult using your own style by borrowing various parts from each consultation model. We have got over 50 testimonials from GP trainees of health, and these are just some of them from the last sitting and last few sittings. As you can see, many of the GP trainees found the program very useful, and it has helped them to consolidate the consultation and be able to pass the exam. A lot of people think like when they're reading books, they're going to improve and learn. But Confucius tells us, I hear, I forget. I see and I remember. I do and I understand. So if you're learning to swim, you're not going to learn swimming by reading a book on it. You're going to learn swimming by dipping your feet in the water and then getting into the water and swimming. So similarly for consultation skill, you need to practice and get feedback and refine it. So this is why I'm going to launch MRCGP SCA Masterclass on the 19th of August. So we'll go through 10 live SEO role plays with simulators who are professional simulators, male and female. You will get a chance to practice, receive feedback from myself. I will demonstrate best practice for you. You will learn how to use advanced communication skills to be able to boost your score in all three domains. And we will go through cases that you might find challenging. So, for example, professional dilemma and safeguarding. These are cases that most GP trainees struggle with. So this is something that we're going to cover in the masterclass on the 19th of August. I would love to be part of your journey to help you with your SCA. If you'd like to join, I'm giving you an offer where you will get the masterclass and you will also get an online program where you will be able to watch the case demonstrations. You go through over 35 lessons in the blueprint. You get a companion as well where you can plan your progress and make sure that you keep track of your progress. So you will also get 2 other invites to interactive masterclass plus the one on the 19th of August, and join a thriving community of like-minded GP trainees who are preparing for the exam. So this is very important because you don't want to sit this exam preparing on your own and doing things without getting much feedback. So this is a program where you get a series of teaching from myself, and there will be a mix of recorded plus live teaching. If you'd like to join, you can go on bit.ly/SCA program, or feel free to scan the QR code, and you can get this offer. This offer is not going to last long because the price will go up once we got over 5 people who join. So make sure that you join if you'd like to join us on the 19th of August and get access to the whole blueprint. And I will be updating the blueprint. I will be adding some more cases to it. So if you lock in this price today, then you can secure your spot for the 19th of August. If you want to work one-to-one with me, I've also opened up a few spaces for one-to-one. I don't do a lot of one-to-one because of other commitments, but if you'd like to go through a personalized support, you will get access to everything we've talked about, the masterclass, the online program, plus 2 one-to-one mock SCA session with me. If you take the premium package, if you go on the VIP package, you'll get 3 one-to-one mock SCA session with me. So that's available, but there's not a lot of spaces remaining. I've just opened a few spaces. So if you want to get that offer, feel free to scan the QR code or click on the link. So let's summarize now. What we've talked about for the preparation is really about how you plan it early. Make sure that you understand your exam and read the MRCGP website on the SCA. Make sure you understand everything about the exam. Manage your time effectively. Go and study the marking and the feedback statement and identify the areas of weakness from your blueprint that we've just discussed. So a few practical tips. It's important that you practice under exam condition. Make sure that you practice under exam condition at least a few weeks before the exam so that you know how it's going to be like. Record and analyze your consultation. Seek constructive feedback regularly. And the last one is really important. The way you learn is by reflecting on what you've done as well. So if you've done something, reflect on it, as in what do you need to stop doing, what you need to continue doing, and how you're going to implement that for your next consultation so that you course correct. And by doing this micro refinement over time, you will have much better consultation. If you'd like to join our support group, feel free to join our Facebook group if you haven't already joined. You can scan the QR code. I wish you best of luck with your preparation. If you've got any questions, I'll still be here to answer your questions. So feel free to ask me any question if you've got. So if you've got a technical issue during the exam, there will be a person who is responsible for the running of the exam. They will be able to advise you about if a station needs to be rerun or not. So that's something that the college has been piloting, and they have already done rerun and seen how the process works. And in most cases, there is no need for rerun. It's only in very few cases where they had to do some rerun.